today we'll discuss about this one treatment of delirium. So in last class we have discussed about delirium, isn't it? Then difference between delirium and dementia. So anyone tell me what are the main difference between delirium and dementia? Anyone remember?
Delirium is an organic mental disorders which is characterized by disorientation, disturbance in perception, and impairment of consciousness. And dementia is a condition in which there is an impairment of intellectual memory and personality, but there is no impairment of consciousness.
Okay. So delirium and dementia both are organic disorder only, okay, organic brain disorder only. But the onset now, the main differences in dementia onset is means it will take time, years or like that. But in delirium, very acute onset. Okay, then whatever you said, consciousness, it is in delirium, it is affected, but in dementia, it is not that much affected. Then alertness also, in the dementia, the alertness may be this one, not that much strong, but in delirium, it is not affected. So the basic difference is that the onset, okay, and the consciousness. Okay, so treatment will, let's see what are the main treatment of this one delirium. So first we have to identify the main cause of this one delirium. What is the main cause? So say like we have to find out the cause, and depending on that, if we find out that cause, then we have to treat that cause, then that patient will improve. Say like if hypoglycemia is there, then we can give dextrose. Then for hypoxia oxygen we can give. Then sometimes due to vitamin deficiency also this kind of disorder occurs. So for that we can administer this one vitamin, then fluid and electrolyte. So you will see in this delirium now maximum patient those who are mostly takes this substance, alcohol abuse patient. Okay, so that kind of patient will, there is a higher chance of having delirium. So in complication also I have discussed already in this one substance abuse disorder. So I hope all of you remember about Korsakoff sign and encephalopathy. Anyone remember Korsakoff sign? So because of that also later on this Korsakoff sign or encephalopathy, this is in substance abuse disorder, it is occurred due to lack of vitamin deficiency or thiamine deficiency. So later on it can cause delirium also. So this delirium is very much common in substance abuse, mostly in alcohol abuse patient. Okay, so if there is a cause of alcohol abuse and because of thiamine deficiency, because alcohol withdrawal or alcohol dependent patient have higher chance of having thiamine deficiency. So if thiamine deficiency is there, then we have to treat that cause, then this delirium will means that there is a treatment for that only. Then like that benzodiazepines we can give if patient is having problem with sleep and all. Then mostly this diazepam and lorazepam they used to give. Then antipsychotic also we can give, like haloperidol or chlorpromazine we can give, because this diazepam is also important because patient in delirium state patient become this one not that much oriented, and patient used to roam here and there, or his orientation is affected. So that's why this diazepam or benzodiazepine is given, so that patient will means uh, uh, with the injection, this drowsiness or it can be clear and patient can sleep. So the main reason of giving diazepam or lorazepam is because of that only they used to give. Then if psychotic symptoms are given are there, then haloperidol used to given. Okay. So this today's class not that much long because I think only one more disorder, that is amnestic syndrome, is there. So that part I will discuss. Then two more topic I think in organic brain disorder is there. It is very short, like personality disorder or something like that. So these two topic, all of you read it by yourself because it is not that much important also, and it is like uh, very few things. I think definition and treatment part or like that something they have given in your book. So I'll not discuss in depth about this disorder. Uh, Only amnestic part, amnestic disorder will discuss. So in organic brain disorder, basically this delirium, dementia, and amnestic disorder, these three disorders is important. Okay, so under dementia, what are the types we have discussed? Like we have discussed about vascular dementia, Alzheimer dementia. So these types also important. So and delirium. Okay, so next we will see about what is amnestic syndrome. So let's see about organic amnestic syndrome. So it is characterized by impairment of memory and global intellectual functioning due to underlying organic causes, and there is no any disturbance in consciousness. So this till now whatever disorder we have discussed, so everywhere it is you find that in under organic disorder that memory impairment is there, like dementia also in memory impairment is there, and delirium also it's there. Then amnestic means what? Amnesia means forgetfulness or memory impairment, isn't it? So that's why this amnestic uh, in under amnestic syndrome, this memory impairment is there and intellectual functioning is impaired due to organic causes. So organic causes is required, but in consciousness there is no any impairment in consciousness. Okay, only memory part is affected in amnestic syndrome. So by the time amnesia only, I hope all of you have understood that amnesia means this one forgetfulness. So in amnesia also there are various types of amnesia is there. So anyone know about the types of amnesia? Anyone know?
Retrograde amnesia, ma'am, and retrograde amnesia.
Yes, retrograde amnesia, intrograde amnesia. So do you know what is retrograde amnesia? What is intrograde amnesia?
So, ma'am.
So this retrograde amnesia, as a whole, you now all of you remember that this retrograde amnesia means whatever memory previously you have made, na, that thing mean in past life, whatever memory after means in past life, whatever memory you have made, that thing you will not able to remember. Okay, but in anterograde amnesia, currently whatever is going on in your life, in current situation, means uh, during your time, whatever is going on, you not able to memorize, means you are not able to form these new memories. Okay, but in retrograde, whatever happened in your past life, that thing you are not able to memorize. Okay, so along with retrograde and anterograde amnesia, like one more is there, that is uh, uh, transient global amnesia is there, then infantile amnesia is there. Okay, so there are some other types of amnesia also there, but in your books it is not that much in depth. Only definition, then treatment. Treatment is also not there. Only um, symptoms, only this part very briefly it is written. Okay, but treatment part it is not that much this one, because there are some certain causes. We have to find out that cause, and according to that cause only we have to give treatment. Okay, so next see what are the etiology. So first one is thiamine deficiency. So this thiamine deficiency, before also I am telling you all that because of alcohol abuse or alcohol dependent or alcohol withdrawal patient, this thiamine deficiency is very high. And because of thiamine deficiency, later on this Korsakoff sign is it's used to occur. And that's why this amnestic syndrome later on it may cause, or delirium may occur. Okay, then head trauma, because of head trauma also amnesia occur. Then bilateral temporal lobectomy. So sometimes some due to some brain disease, sometimes lobectomy also they used to do, like lobectomy. It is a type of surgery. So say like if someone is having tumor, brain tumor, so because of that tumor sometimes lobectomy they used to do. So because of that also this amnesia it's used to occur. So in various serials or some TV series, you will find that if someone is having brain tumor, after that something will happen like that. They used to show like memory impairment will be there like that, but it is because of surgery. It may there is a chance of having this one. Memory impairment or amnestic disorder. Then severe hypoxia also one cause of amnestic syndrome. Then brain tumor, that is also I already explain you all about this lobectomy and all. Then because of stroke also it may occur. So this is about the etiology. Then clinical feature, so recent memory impairment will be there. Then anterograde and retrograde amnesia, what we have discussed. So these two amnesia also occur in this one, amnestic syndrome. Okay, so this is about very briefly about amnestic syndrome. So for your exam purpose now, the most important part is dementia and delirium. Amnestic syndrome also it's used to occur, but it is not that much frequent. But this delirium and dementia in depth, all of you go through it. Okay, and if you will not understand anything, then let me know. And for amnestic syndrome also treatment part, you have to whatever etiology we got, depending on the etiology only we have to give the treatment part or medication we have to give. Okay, understood? So this organic brain disorder will not discuss anymore. Okay, about this. This is the last class for this unit. Okay, so any doubt, anything you want to ask? Anything you want to ask?
No, ma'am.
Okay, so in your book, I think two more in this unit only. Two more disorders there, like mental disorder due to brain damage or dysfunction of and physical disease. Then personality and behavior disorder due to brain damage, it is also there. So these two disorder, it is not that much this one important. Okay, but you have to know like some disorder occur due to some dysfunction of brain or brain damage like that. If physical dysfunction maybe because of that it's used to occur, like in hypothyroidism also, or various other disorder like epilepsy, then head trauma, then hypoglycemia. So because of that also some mental alteration it's used to occur. So you should means it is all of you, I think all of you know that we already discussed no, like vitamin deficiency. So because of this dysfunctional, if endocrine dysfunction is there, then if other physical illness or brain damage or physical ill because of that, if sometimes some mental illness is used to occur. Okay, so this is also like mm, cause or create some mental illnesses. Okay, then like say like same with personality disorder also, like because of head injury or like seizure, various seizure or some CVA problem, because of that also sometimes this mental or personality changes may occur. So that thing only it's written, you all of you go through it once. If you will not understand anything, then you can ask me. Okay, but for this unit, I am telling you all of you by heart about this one, delirium and dementia. Okay, short notes it's very much common in common. Short notes, delirium or dementia, it's used to come. Okay, okay. So nursing management, I think as a whole, all of you able to write. Mostly, what type of diagnosis you will make for this organic brain disorder? As a whole, I am asking because individually is disorder, it is not that much important. If you know the main diagnosis 3 or 4, that is also enough for you all. So anyone tell me any nursing diagnosis for this organic brain disorder? Like for delirium or dementia, so what are the main nursing diagnoses you will make? Hmm? What will happen if memory impairment is there? Don't know.
Ma'am, risk for injury, ma'am.
Yes,
To self.
for it. Yeah. Then one is risk for injury. Then
Step thought process, ma'am.
step thought process. It is also there, but it is not in that much. This one. You can say other diagnoses also, which are very common.
Ma'am, then impaired health maintenance will be there.
Yeah, impaired health maintenance. Then self-care deficit will be there, isn't it? So if patient's
Yes, ma'am.
consciousness or orientation or memory will be impaired, then obviously self-care deficit will be there, isn't it? Then impaired food, this one, imbalanced nutrition will be there. Okay, then disturbed sleep pattern will be there. Okay, so these are the basic diagnosis for as a whole you can write. Okay, then one more, it is impaired memory related to organic causes or whatever causes you will get. Okay, so these are the main nursing diagnosis, and I hope all of you are able to write about the management part. And intervention, that day also I am telling you what type of education, health education or psychoeducation you have to give to the patient or patient family members. Anyone remember? I'm telling so many things too that day. What I said. For dementia patient, what happened? That day I'm telling so many things now. Like day-to-day orientation with the patient, family member of patient, is not it? Then date and time every day we have to remember. Means reality orientation that day we have discussed, is not it? Then ID card or something we have to keep in patient with patient so that if patient sometimes lost, then we can relocate the patient. So these things you have to write. Okay, these are the very important thing. Okay, so this is about this one, your organic brain disorder. So if you don't have any doubt, then we'll finish it here today. I think from tomorrow we'll discuss one topic, that is personality disorder. Okay? Okay. Thank
Okay,
you.
ma'am. Thank you.
Thank
Send me the
you, ma'am.
attendance, okay? See ya.